Good evening, doctors. Welcome again. Today I'm going to discuss here about 2016 till 2020 radiology MCQs paper, previous year paper, and this is first part, and one more part is, and then we discuss all radiology. So today's first part of radiology, the relationship of femoral artery, femoral vein, and spinous vein at spheno-femoral junction is known as. This question asked in NEET PG 2020. Mickey Mouse sign, C. Mickey Mouse sign, stemmer sign, dialogue sign, string sign. So this is a sign of, we can say here, this is a sign of, answer is Mickey Mouse sign. The Mickey Mouse sign representing the normal anatomy of common femoral artery, common femoral vein, and great spinous vein at the spheno-femoral junction. Good evening. Now, Roentgen is a unit of. Roentgen is a unit of. This question is also asked in NEET PG 2020 examination. So the answer here is radiation exposure. Whereas for radioactivity, the unit is Curie. Curie. Radioactivity AC. C means Curie. Absorbed dose means rad. RAD. So start from A. Good evening, Suresh. And dose equivalent means RAM. REM. So equivalent E and RAM. Now, so let's see here. For Roentgen, answer we see radiation exposure, and absorbed radiation RAD, absorbed A, and effectiveness or equivalence is for RAM, E for effectiveness, E for equivalence. For radioactivity, activity C for Curie. That's why answer here is radiation exposure. Hope it's clear. Now, a pregnant lady underwent single accidental exposure to X-ray at 7 weeks of gestation. What advice will you give to her? Continue pregnancy, termination of pregnancy, pre-invasive investigation, karyotyping. So this question is also asked in NEET PG 2020 examination. So what is the best answer here? Answer is continuation of pregnancy. Yes, but why? Let's see why the continuation of pregnancy. Effects of dose less than 0.05 diagnostic imaging studies typically expose the fetus to less than 0.05 or 50 microgray or 5 rads, and there is no evidence of increased risk of fetal anomalies, intellectual disability, growth restriction, or pregnancy loss from ionizing radiation at this dose level. The margin of safety is augmented by the fact the most human exposure from diagnostic imaging will be fraction over a period of time. I hope it's clear explanation now. Personal monitoring of radiation dose is done as those who are working in operation theater or in radiology wards in laboratory, they know this answer. So I'm going to remove comments now. So answer here is personal monitoring of radiation dose is done as lead shields, TLD badge, LINAC, gamma camera. So which one is the best answer here? It's hi. Answer is TLD badge. Answer here is TLD badge. Let's discuss why. When you are in an operation theater, you have to wear TLD badge here when radiation exposure, or in radiotherapy in X-ray department, and you are going to wear lead apron. So TLD badge is there. What is TLD? TLD is thermoluminescent dosimeter badge, is a passive radiation detection device that is used for personal dose monitoring. measure patient dose. TLD measuring ionizing radiation exposure by measuring the amount of visible light emitted from a crystal in detector. When the crystal is heated, the amount of light emitted is dependent upon the radiation exposure. So answer here is TLD batch. Now, non-ionizing radiation among the following is MRI, CT scan, X-rays, positron emission scintigraphy. So which one is the best answer here? Yes, answer is A. It's MRI. Yes, MRI is absolutely safe in pregnancy. Even sonography is safe, and MRCP is safe. So, you have to remember non-ionizing radiations like USG, Doppler, MRI, MRCP, thermography, infrareds, except all are radiation. All are ionizing radiation. Non-ionizing is this only. Now, okay, identify the radiological procedures shown below. Barium meal follow through, anthrochlesis, barium enema, proctography. So which one is the best answer here? What is the single best answer here in this scenario? What is the single best answer? This is barium meal follow through. Absolutely right. So I'm going to explain what is barium enema. Barium enema we are going to use for colon. For colon, barium enema we can use. For small intestines, we can use barium meal follow through. For esophagus, we use barium swallow. For stomach and duodenum, we use barium swallow. Let's see. Use barium sulfate suspension, barium swallow for pharynx and esophagus. Investigation of choice for swallowing disorder is barium swallow. Whereas, let's discuss completely. For stomach and duodenum, barium meal, and barium meal follow through for small intestine like jejunum, ileum, and barium enema for colon. So, guys, and one more thing that is very, very important. Tracheoesophageal fistula, aspiration, non-ionic, ionized, iodinated contrast like Hexol. So many times they like to ask, even in RMO paper, they like to ask such questions. Prevent pulmonary edema, and sodium ditrazole for non-ionic iodized contrast. Hope it's clear now. Okay. What would be the contrast of choice in esophageal perforation? This question asked so many examinations in 2020. Even in UPSC CMS, they like to ask. In RUHS examination, this same question they asked. So which one is the best answer here? Answer is Hexol. Yes, Harshit Chaturvedi and Thomas, you both are absolutely right. Jamila, everybody is answering perfectly. So, answer is Hexal. Now, barium meal follow through is helpful in diagnosis. I discussed this question in a detail. I already explained. So, what is the best answer? Barium meal follow through is helpful in diagnosing colonic stricture, ileal stricture, rectal stricture, or esophageal stricture. For esophageal stricture, there is barium swallow. For the stomach and duodenum, there is barium meal. And for ileal stricture, there is barium meal follow through. And for colonic stricture, barium enema. So, guys, I hope answer you got it. Answer is B, ileal stricture. So, all four options you have to know which one is the best answer. Okay, if you know all four options, that means you are going to score excellent rank in examination. Now, T2 image in MRI is good to detect pathology, good to detect anatomy, good for both, good for none. So which one is the best answer? And I'm going to explain you how to memorize this. I will give you some trick to remember this answer here. So, okay, I'm going to explain. After my explanation, nobody is going to forget the answer here. Okay. T2 image in MRI. Remember, when you are in a first year, your first subject is anatomy, and after the anatomy, you are going to study pathology, second one. So remember, T1 image for anatomy, first subject is T1, it's anatomy, and after anatomy you are going to study pathology. So T2 imaging is for pathology, remember by this way, mnemonic. Okay, now T2 image in MRI is good to detect for pathology, but good to detect for anatomy is T1. Let's discuss more. In T1 W1, time taken for 63% longitudinal magnetization to be recovery depends on spine lattice interaction. Whereas T1 image is hypotense, T2 is hypertense. Remember, T1 is hypotense, T2 is hypertense, T2 is always hyper. Pathology is hyper, anatomy is hypo. CSF in T1 weight MRI gives following appearance: hypotense, hypertense. I already explained. Remember, pathology is always hyper. So T1 image is hypotense. Okay. Next question. Hounsfield number of water is. Hounsfield number of water is. Yogesh, these MCQs even asked in FMGs also. So don't think these MCQs are for NEET PG. These all MCQs are for PG, for UPSC. In so many examination they like to ask, even in INI CET. Don't think this is for zero. How to remember zero? Hounsfield unit number for water is zero. Why? When you want to catch water in your hands, it's not possible to catch water in your hand. That's why zero. Remember zero. Okay. And I'm going to explain more thing. Hounsfield unit for air, if you want to hold it by your hand, that means 1,000 of particles. Remember 1,000. It's and fat, if you are going to eat fat, you are 100% going to be fatty. By such tricks you can remember. Water and CSF is 0, air is 1,000, fat is 100, and acute bleed is 60-70. Acute bleeding mainly occurs in the age of 60-70. This is mnemonic to remember. Contrast is 130, calcification 200 to 250, and cortical bone is 400 to 1000. So guys, this year they asked, previous year they in 2020 they asked Hounsfield unit of water. So this year most probably they can ask about air, it's 1000, or maybe they have probability to ask about fat, that is 100, or they can ask about acute bleeding 60 to 70, or maybe about contrast is 130. And if you are very lucky, then they can repeat this question, but not this year, maybe in 2022 about water. Now, boot shape hurt in tetralogy of Fallot is due to left atrial enlargement, right atrial enlargement, right ventricular hypertrophy, biventricular hypertrophy. So which one is the best answer here? Tetralogy of Fallot, boot shape hurt is due to. Try to answer in the comment box. Boot shape hurt in tetralogy of Fallot is due to. So answer here is right ventricular hypertrophy. Right ventricular hypertrophy. Let's discuss. Yeah. Let's discuss about all. Now, firstly, Snowman Heart or figure 8 is supracardiac TAPVC. Okay, we see dilated vein, left brachiocephalic vein in middle, and superior vena cava on right head of Snowman, and large right atrium, body of Snowman. Whereas egg on a string, egg on side is transposition of great arteries, we can say narrow vascular pedicle with atrial enlargement, whereas boot shape hurt, core and sabut, tetralogy of Fallot, unruptured apex, right ventricular hypertrophy, and concave pulmonary artery. Box-shaped heart seen in Epstein anomaly. Use right atrium wall-to-wall cardiomegaly. So this picture represent Snowman Heart or Sign 8, and this one picture eggs on a string, that is transposition of great arteries, and this is boot-shaped heart mainly due to right ventricular hypertrophy seen in tetralogy of Fallot. Now, all of the following produce pulmonary oligemia except TAPVC, tetralogy of Fallot, atrial septal defect, tricuspid atresia. So which one is the best answer where we are not going to see pulmonary oligemia? So try to answer in a comment box, guys. So answer here is TAPVC. Let's discuss. Increase pulmonary vascularity or pulmonary pleuthora. So we seen where in total anomalous pulmonary venous return, in transposition of great arteries, truncus arteriosus first, second and third type, and single ventricular without pulmonary stenosis, whereas decreased pulmonary vascularity and pulmonary oligemia seen in tetralogy of Fallot and rest other. So answer here is TAPVC. Hope it's clear now. The following abnormality of aortic knuckle is seen here. So what is the cause of this abnormality? TGA, PDA, coarctation of aorta, pulmonary artery hypertension. So which one is the answer? We see here sign 3. Sign 3 seen in where? In which disorder you are going to see sign 3? Yeah, this is a case of coarctation of aorta. Coarctation of aorta. Yes, everybody is right. Yeah, this is figure 3. Let's see here. Seen in coarctation of aorta. Figure 3 sign is formed by pre-stenotic dilatation of aortic arc and left subclavian artery. Indentation at the coarctation site, also known the tuck, and the post-stenotic dilatation of descending aorta. Hope it's clear now. Identify the infection from the chest X-ray patient with low-grade fever. This is ILD, bronchopneumonia, miliary TB, consolidation. So best answer here is, try to write in a comment box answer. Okay, I'm going to clear. Now this is chest X-ray. And guys, if you like my video, please don't forget to put like on it. So answer here is, this is miliary TB, miliary tuberculosis. Absolutely right. This is case of miliary TB. Let's discuss why. Miliary nodules, myeloid seed opacities seen in TB, histoplasmosis, metastasis, sarcoidosis, healed varicella pneumonia, pulmonary hemosiderosis. Tree in bud appearance, multiple areas of centrilobular nodules with linear branching pattern seen in endobronchial spread of tuberculosis and active infections. Now, we already discussed this is miliary tuberculosis. Now, all of the following are seen in X-ray of left ventricular failure except cephalization of blood flow, curly B lines, cardiomegaly, oligemic lung fields. So what is the best answer here? So what is the single best answer here? All of the following are seen in X-ray of left ventricular failure except, yes, oligemic lung fields is not seen in left ventricular failure. Absolutely right. Yes. Let's discuss. Chest radiograph remains the most practical and useful method of radiological assessing and quantifying pulmonary edema, which is commonly due to left ventricular failure. Features useful for broadly assessing pulmonary edema on a plain chest radiograph include pulmonary venous congestion, upper lobe pulmonary venous diversion, increased cardiothoracic ratio, or peribronchial coughing, septal lines, Curley lines, thickening of intralobular features. So all are there, but oligemic lung fields is not a part of left ventricular failure. Now, 45-year-old female presented with chest pain and breathless in the ER, and below is the representative CT section. What is the most likely cause of her symptoms? Aortic dissection, pulmonary embolism, aortic aneurysm, Budd-Chiari syndrome. Guys, I want to say, if you don't know the image, even if you are not going to see this image, if you know the answer without seeing image, it's also possible to answer here, and I'm going to explain how. So what is the answer? Please try to answer even without seeing the image. You're able to answer here. Guys, this is a case of pulmonary embolism. Why? What is the most common cause or symptom of pulmonary embolism? That is shortness of breath or breathlessness. So here, chest pain and breathlessness in ER and CT section is seen. So this is a case of pulmonary embolism. Let's discuss little bit about pulmonary embolism. Clinically, if high probability or low probability, if low probability pulmonary embolism, go with D dimer. If D dimer raised, then CT pulmonary angiography is investigation of choice. Even in UPSC they like to ask this year, and if it is normal then rule out. And CT pulmonary angiography is an investigation of choice. Pulmonary embolism in pregnancy, D dimer not used for screening. USG is used to for DVT, and VQ scan is preferred over CTPA. Less fatal dose in VQ scan. Chest X-ray normal in 30%. Hampton's hum, peripheral V shape opacity due to infarct, watermark sign, focal oligemia, Fisher sign, prominent central pulmonary artery, and CTPA imaging done when contrast in pulmonary artery, VQ scan, ventilation, perfusion scan, nuclear scan. Okay, now, so we already discussed this is a case of pulmonary embolism. Now, radiographic sign characteristic of pulmonary edema is Westmark sign, Hampton's hum, Pala sign, bat wing sign. So what is the best answer here? For pulmonary edema, you see in chest X-ray what is visible here. What kind of image on chest X-ray in front of you? This is like a wing. This is bat wing. In pulmonary edema, we see bat wing. Okay, let's see. Bat wing. Okay, this is very high yield MCQ. I hope this year in Neet PG 2021 exam you definitely receive this image. This image you are going to definitely receive. CT scan of abdomen showing the structure marked is, the structure marked here is superior vena cava, inferior vena cava, aorta, thoracic duct. So answer here is the structure marked with star is which structure? Yes, inferior vena cava. So guys, this is a inferior vena cava, and today's part, last MCQ: which artery has been shown in the following CT radiographic image? So this is a case of superior mesenteric artery. Yeah, and guys, remember this image. You have to, when you are going to sit in exam NEET PG 2021, at least see this image. The first mark point represent inferior vena cava, second point represent right kidney, and third is origin of right renal artery, fourth is aorta, fifth is left kidney, and sixth is left colon, seventh is superior mesenteric artery, arrows are there, and eighth is superior mesenteric vein, and ninth is gallbladder, and 10th one is liver. So guys, before sitting in NEET PG 2021, 1 hour before your exam, please go through this image. This is very high yield and you definitely receive one MCQ from this image. And this is superior mesenteric artery angiograph branches. Only second part is left. Rest 20 MCQs I am going to discuss. 20 I already discussed, but in 20 I already explained all 4 options and we discuss in a detail also. So this is not 20 MCQs radiology. This is nearly about 200 MCQs, and next 20 MCQs I am going to discuss day after tomorrow, not tomorrow. Tomorrow I am going to discuss psychiatry MCQs for previous year 2016 till 2020 exam with explanation of 4 options. If you like my videos, put like on it. If somebody is new on my channel, please subscribe my channel, and if anybody wants to join my WhatsApp group, they can join it. And my request to put there some MCQs. If you want to ask, you can put some image based MCQs, and I want some group discussion will be there. So guys, if you like my videos, put like on it, and good night and all the best for your examinations. All 19 subject previous year MCQs I am going to finish in last 2 months, and please revise this. And if you feel that MCQs are going to be repeat, MCQs are not going to repeat, but 4 options, if you know the all 4 options, MCQs are coming from such options. For example, they ask about water, Hounsfield unit is 0. So this year there is a lot of probability they can ask about air Hounsfield unit. So that is 1000. For fat, Hounsfield unit is 100. So this is the probability they can ask in such a way. And CSF is 0. And for blood, acute blood, there is 60 70s. So you have to memorize, and for contrast there is 130. So such way they are going to ask MCQs. This year they are not going to ask about inferior vena cava. Maybe they want to ask about left colon on diagram, or maybe left kidney, right kidney, or maybe about aorta they want to know. So guys, prepare in such a manner. Previous year they asked superior mesenteric artery. Maybe this year they want to know about inferior mesenteric artery or vein. Yeah, I'm going to post all 20 MCQs left, but there I'm going to discuss CT, MRI, all images in my next video day after tomorrow. Tomorrow is same time 11 past 5 psychiatry MCQs live lecture. Thank you. Good night. If you like my videos, put like on it, and if somebody is new on my channel, subscribe it. Thank you and goodbye.